Now, before you head to the ER, doctors are asking you to reconsider if it is a true emergency. Today, I spoke with ER Director Dr. John Matheson at Cadleck, who says their department is filling up and resources are stretched thin amid the Omicron surge.
We train for crises, we're prepared for them, but prior to this, we thought of the crisis as that sudden surge that we go in, we take care of it, and then it's over. 2 years into it, it's long, it's hard, but we have a job to do.
Dr. John Matheson, the ER director for Cadleck, says healthcare workers are being stretched thin as we face the Omicron variant. He says the ER is filled, and if possible, you may want to avoid it.
We want to be a resource. We do not want to discourage anybody who has a serious medical condition, certainly anything that they believe to be an emergency, from coming to the emergency department. That is why we are here.
But if you go with the sniffles, you may leave sicker or with the virus itself.
Not only are the public getting sick, but we have caregivers who get sick, and it causes a strain on staffing.
So when do you go to the ER?
Chest pain, difficulty breathing, mental status changes, confusion, things that are true emergencies should come to the emergency department.
Notice a COVID-19 test isn't on that list.
The emergency department is not a testing center and not an appropriate testing center. We simply do not have the resources to do so.
Maybe you have a minor cut that needs to be looked at, or a sprain. Dr. Matheson says in that case, you should probably reach out to your doctor in urgent care or a Cadleck Express Care.
For the routine minor things that can and that can be seen elsewhere, it's probably more appropriate. And with the resource limitations we have now, we have to ask that you try to do that when appropriate.
And when it comes to kids, we know that most have bounced back fast from COVID-19. But Matheson says if they're struggling to breathe, are dehydrated or lethargic, that is a sign to bring them to the ER.